cause started as a frank conversation between myself and a concerned patient. After that conversation, that patient came to me later and said, if you're interested in getting a reform of the national healthcare system started, I'll back you up. And so here I was, a single individual with a lot of ideas about how the national healthcare reform should take place, but it really took me meeting the Central Valley Health Policy Institute at California State University, Fresno, to really get the plan on track. And working with Dr. Capitman has been wonderful. I'm a physician, specializes in internal medicine, and I've taken care of patients for 20 years. Dr. Capitman is very well versed on healthcare policy, and melding the two together created cause. What cause is it is a mission statement for what every national healthcare reform bill must have, and that is continuity, affordability, universal coverage, sustainability for the nation, and effectiveness. And what that means is that it needs to be continuous. Once someone is covered by the health insurance, there should be no lapses in coverage, whether or not an individual's economic circumstances change or they change jobs. That coverage must be continuous. It needs to be affordable to the individual and the nation. It needs to be universal. At full implementation, everyone needs to have some sort of healthcare coverage. It needs to be sustainable, meaning that there needs to be a financial mechanism that in good times and bad, the plan is well financed and endures the test of time. And it needs to be effective, meaning that it makes our nation's populace healthier. What makes cause different than all the other plans is its implementation. We implement the plan over 15 years. None of the other discussion of other plans in Washington talk about how they're going to implement their models. And it's necessary to implement it over 15 years because it doesn't make sense to give a bunch of people health care coverage without being able to deliver on the care. By phasing it in over 15 years, there are enough physicians and other healthcare providers to take care of the newly insured. There's enough time to make it affordable for the nation to pay for. There's enough time for cost savings to be realized through such matters as information technology and better administrative efficiency and preventative care. So the 15-year implementation is what makes us different. We tell you how to do the plan, not just say that we're going to enact these reforms. The first phase, which is 5 years in duration, we cover children. And to us that makes perfect sense, to give preventive care to children. And so that first phase has a finite cost. And the way of financing that phase would be through increasing the tax on tobacco by $5 a pack, which will not only generate revenue but will curtail smoking, which costs society a lot in healthcare expenses. But we also introduce a financial transactions tax. And what that is it's a 0.5% tax on the sale of stocks and bonds. And there's a smaller tax involved in the trading of other securities like currencies, oils futures, things such as that. And the beauty of that is that there is already a framework for that type of financing, because that framework exists to help pay the fees for the Securities Exchange Commission. And it can generate, even if one estimates a 30% decrease in trading, $150 to $200 billion in a year, which is enough to finance the first phase of our plan. The beauty of it is that people who invest and hold are not hit very hard by this tax. But people who churn their investments, and are constantly trading and speculating are the ones that pay more. And so why not curtail some of this speculation? And why not allow Wall Street to help pay for part of healthcare? Through greater efficiency in administration, through information technology, by practicing evidence-based medicine, and by altering fee schedules so that physicians order what is really necessary to help make people healthier, there will be cost savings, estimated by the Commonwealth Group of $1.8 trillion over 10 years. But more importantly, it becomes affordable because the cost of it is spread over 15 years. And the first 5 years, we already have the financing of that in place through the financial transaction tax. You're also going to have a society that's more productive because they're healthier. And you'll have healthier employees because their health care is no longer tied to whether or not they have employment. So the fact that it's split over 15 years, the first phase is already has the financing in place, and you're making society healthier and having things like administrative efficiency and evidence-based medicine makes it affordable. What I'd like to say is this. This is the most important thing that the Obama administration is going to deal with in the upcoming term. There is no single thing more important than one's health. If anyone who's been a patient knows that when they are ill, they are at their most vulnerable. So if you can have a plan that is truly enduring, meaning it stands the test of time, that gives everyone a safety net for public coverage, but allows for people to have the choice of going to pay for private coverage for things that the public plan may not offer. You have given a gift to the country, and yet you have managed to maintain choice. There is nothing more important that we can do for our people than to help make them healthier. And cause is a way of doing it. It provides the framework of how to do it over 15 years. I'm proud to be a part of it.